Good afternoon. I'm Roy Buell, Mayor of Dubuque. I'm pleased to be joined today by Dave Baker, Chairman of the Dubuque County Board of Supervisors, along with leaders of our local healthcare providers. Supervisor Baker and I are here to speak directly to the residents of Dubuque, Dubuque County, and the tri-state region about the COVID-19 pandemic, and to assure you that your local city and county governments are in lockstep and focused on responding to and maintaining the communication, critical services, and infrastructure upon which we all rely. I want to now speak to the residents of the city of Dubuque. My city council colleagues and I remain focused on your health and well-being, and will continue to work closely with our local public health officials, state and federal agencies, and multiple partners to provide information and resources to individuals, families, businesses, and organizations. At this time, we continue to urge residents to be part of the solution and stay safe, stay home, as you are able to help flatten the curve and limit the spread of coronavirus. Each of us, and let me reiterate that, each of us has a responsibility to this community we call home. It is simple. Follow the educated direction of our healthcare professionals and experts. Practice physical distancing when you find you must leave your home for essential supplies or healthcare or to work. To those businesses deemed essential, I ask that you please be a part of the solution by limiting the number of people allowed at one time into your location to shop in order to emphasize and re-emphasize physical distancing. It is my honor to recognize leaders of our local healthcare community with us today, including Kay Takis, President of MercyOne, Dubuque and Eastern Iowa region, Chad Wolbers, President and CEO of UnityPoint Health, Findlay Hospital, John Talent, CEO of Medical Associates Clinic and Health Plans, Justin Hafner, CEO of Grand River Medical Group, Mary Rose Corrigan, representing the Dubuque County Public Health Incident Management Team. Shortly, they will be sharing information on the steps they have taken and are planning to take to help us to stay safe. I want to convey the collective gratitude of our community to all our healthcare professionals and to all essential businesses and organizations providing the critical services and goods we need to survive. I likewise want to convey our collective gratitude to our first responders, our emergency dispatch, fire, police, and sheriff's departments, and our public health staff. Our unsung heroes, managing our water and wastewater system, trash and recycling, and public transit. Our local nonprofit community and government agencies who continue to work to serve our most vulnerable residents. And our restaurants and other retail preparing orders for pickup or gift cards for future use, as well as private citizens sewing masks for potential use by our healthcare providers. This is the unity in community. God bless you all, and thank you.
Thank you, Mayor Buell. On behalf of the Dubuque County Board of Supervisors, I would like to express my sincere gratitude to the local healthcare providers who have been working tirelessly over the past several weeks to care for the ill and also plan for increases in local COVID-19 cases and the potential surge. We support our healthcare providers and want to be available for assistance should the need arise. As a government, we are prepared to help in this battle against the coronavirus pandemic. Having made good budgeting decisions over the last 3 to 5 years, we are positioned to join with all of our partners in this effort. As we stand here today, there's certainly a lot of stress in your jobs. Also, there's a lot of stress especially for the jobs of your frontline providers and direct care staff. I have close relatives who serve faithfully in the healthcare field. Many of those work for the folks that are representing their organizations here today. And I'm reminded of our firefighters who on a regular basis run into burning buildings to save people. This is essentially what our doctors, nurses, technicians, CNAs, and all the support staff are doing right now and every day since this pandemic came upon us. I strongly agree with my good friend Mayor Buell, and please take only necessary trips to the store or the restaurant or tavern for carry-out food. And if you need to get outside, that's encouraged. But there's plenty of county and city parks and recreation areas that you can utilize that will allow you to exercise social distancing or spacing. Keep the 6-foot rule. It's probably, sometimes people joke about having a 6-foot stick, but it's really not a joke. We need to maintain our distancing. In closing, please remember you are not stuck at home. You are safe at home. Thank you. Kay Takis will be up next.
Thank you. I'd like to start by recognizing the team at MercyOne and at all of our healthcare facilities for their remarkable dedication and commitment to caring for our community during this pandemic. They are an inspiration, and it is my great honor to work with all of them and the leaders on the stage today. At MercyOne, we've really had a two-pronged focus. Just like everyone within our communities, our first focus has been on containment to reduce the spread of the virus, critically important. And our second focus has been preparation for a surge in the number of patients needing care. So containment, obviously critically important. We've been working on this for several weeks and will continue focus on containment throughout the course of this experience. We've done things like strict visitor restrictions. That is really no visitors into the hospital except with very few exceptions. Staff and visitor screening and testing consistent with CDC and IDPH guidelines. Social distancing, including allowing people to work from home wherever possible, meetings by conference call. We've canceled community events and curbside and delivery services at our retail locations. Like all of the people who are here today, we've delayed all elective procedures, so we are only doing urgent and emergent surgeries. And of course, segregating patients with symptoms of infection from patients seeking care for different reasons, like cardiac issues, strokes, fractures, and so on. On that note, we're working with a team of leaders, including our public health officials, to stand up a community testing and Fury or fever upper respiratory infection clinic for essential workers and eventually for the community at large, which will obviously help us to identify folks with the infection and get them into quarantine, again, reducing the spread. In addition to containment, as you would expect, we're concurrently preparing for a surge in the number of patients needing hospitalization. Our surge plan, as you might guess, is really a plan that identifies how we will increase our capability to meet the needs of a significant increase in patients. It includes how we will place patients, backup for physicians, nurses, and other caregivers and essential personnel, ventilators and other medical equipment and supplies, personal protective equipment, and so on. On the physical placement of patients, by delaying elective procedures, we have actually created extra capacity in patient beds and in the capacity of staffing. Right now, our census is actually really quite low, so that's a good thing. We've made room for additional patients who may need our services. We can convert single occupancy into double occupancy patient rooms, doubling our capacity for patients on many of our nursing units. We can convert space currently used for ambulatory surgery and recovery room to additional space for patients needing admission to the hospital. We're working with our affiliated and independent critical access hospitals in the area for patient placement as needed. And of course, we're supporting them in their surge planning as well. We're also, of course, monitoring our use of personal protective equipment and really stepping up our efforts to support staff regarding their use of PPE consistent with CDC and IDPH guidelines. Thanks to the many organizations and individuals in the community for your donations of PPE. They have made a material difference in the amount of these supplies available to us, and we're in better shape now than we were a couple of weeks ago in this regard. On that note, we are now allowing staff to use homemade masks in situations that do not require the use of qualified PPE. So we appreciate folks, organizations making those masks as well. We're very fortunate to have several excellent healthcare organizations serving Dubuque and our surrounding communities. We are working in close collaboration with Medical Associates Clinic, Grand River Medical Group, and UnityPoint Finley Hospital regarding our surge plans. We're meeting with these organizations almost every single day about our planning efforts and how we can better prepare, better serve together through this evolving situation. We're also working closely with our public health officials at the city and county who are doing a great job facilitating the public health response to this crisis. We want you to know that we're doing everything we can to be ready to take care of a surge in patients in a safe and effective manner. And we need our citizens to do all that you can do to stop the spread of the virus by following social distancing guidance. Act like you would act if you had the virus and protect others from getting it from you. Push it to the extreme. Containment is the key to making sure we are not overwhelmed and can care for those who are most seriously affected. Thanks, Mayor, for calling us together and for your support as we journey together through this worldwide pandemic situation. Thank you. Chad?
Thank you, Kay. As mentioned, my name is Chad Wilbers, and I am President and CEO of UnityPoint Health Dubuque, Finley Hospital, and the VNA. I, too, would like to extend a thank you to Mayor Buell for facilitating today's press conference and for creating this opportunity for our healthcare leaders to connect directly with the community during this very challenging time. First and foremost, I'd like to assure the community that all healthcare providers, which most certainly includes our team members with public health and emergency management, are working arm in arm to ensure your health and safety. The challenge we face is not specific to any one organization. This is a crisis we unfortunately share, and as such, we will stand together to mount a community defense against COVID-19 as it continues to become increasingly prevalent. Please know that I am in direct communication with numerous healthcare and community leaders on a daily basis, as are other key members of our respective incident command teams. Some specifics to share. Our incident command has been operational since March 13th and will remain open until the crisis has subsided. Critical areas of focus for us, as you're likely aware given ongoing media coverage, have been monitoring our staffing, our physical capacity, and supplies and PPE to ensure we are ready for a potential surge. In regard to our employees and providers, Like all other health systems, UnityPoint Health Findlay Hospital is focused on staffing to ensure we are prepared to care for our patients. We have created both internal and external maps and plans such that we can substantially increase our capacity and ability to care for our community. This will be done through utilizing space within the hospital by doubling patient room occupancy and converting ambulatory space into patient care space. Should we exhaust our resources, we would look to our partners at MercyOne as well as surrounding hospitals in the region to accept additional patients. On this point, and to restate, our organizations are in constant contact and sharing information about our respective current states. On a daily basis, our incident command, as well as MercyOne's incident command, are fully engaged in scenario and contingency planning. At UnityPoint Health, the safety and care of our patients, their families, guests, and team members is always our top priority. And as healthcare professionals, we take our responsibilities very seriously. Our medical staff and infection prevention leaders are following the latest guidelines issued by the CDC and for screening, testing, infection control among patients suspected of COVID-19 or coronavirus infection. Across the tri-state area, Iowa, and the country, people are anxious as the number of cases continues to increase. We will continue to reinforce recommendations from the CDC regarding how people help reduce their risk of exposure to all viruses, including influenza and COVID-19. We ask that our community members heed recommendations and precautions as outlined by the CDC and presented by our public health officials so we can continue to properly care for people in need. UnityPoint Health Findlay Hospital is currently restricting visitors at all hospitals. This is intended to help reduce exposure to respiratory illnesses. In addition, elective surgeries have been delayed to help preserve staff, hospital beds, and PPE. Urgent and emergent surgeries are being performed as usual. And on that note, our plans include creating care scenarios to care for patients needing care for non-COVID related reasons in order to keep them safe as well. Going forward, our goal is to share information that minimizes future community spread, helps to avoid overwhelming healthcare resources, and promotes factual and current details about COVID-19. As we respond to this pandemic, one thing remains the same. We will continue to put our people first, our patients, our team members, and our community members. We are grateful for the organizations we're partnering with in this effort. The response and outreach from our community has been nothing short of amazing. Organizations and individuals have stepped forward to provide food, donations, and PPE. If you are someone that likes to sew or know someone that does, homemade masks are being utilized by non-patient care team members as well. Please see our website for the approved pattern as well as other areas or supplies that we need your support. To close, I'm very proud of our team at Findlay and the VNA to be sure, but I'm also very proud of healthcare workers everywhere during this unprecedented time. You've likely already seen and heard the public mantra that has swept across the country of, we're all in this together. When it comes to our community efforts to keep you healthy and safe as we battle this public health threat, truer words have never been spoken. Thank you, and please continue to be smart, be safe, and just as important, be kind to one another during this crisis. Thank you.
Good afternoon. My name is John Talent. I am the Chief Executive Officer of Medical Associates Clinic and Health Plans. Before I begin my remarks, I also want to begin with recognizing our tremendous staff, many of whom have been working 7 days a week for a while now, and many who are on the front lines caring for those who may be infected with this terrible virus. I also want to make clear that, because it's important for our community to realize this, that the healthcare community, the hospitals and the physicians of our community are united in this fight, and we are preparing. And I also want, hopefully, my remarks to make it clear that we are all relying on all of us in the community to do our part. Our number one goal, the same as everyone speaking today, has been and continues to be to protect patients and to protect the healthcare system so we have sufficient providers to take care of those in need of care. Hopefully everyone understands that if our providers become sick, then we have no one to take care of the sick. This is what we absolutely must avoid. First, we began canceling all elective appointments and procedures, which means those things that can wait, on March 13th. This was done to reduce the volume of people coming into the clinics and hospitals in order to reduce the probability of infecting patients, infecting providers, and ensuring that we are able to maximize the number of beds available in the hospitals. This has reduced 75% of our normal patient volume. So like everyone else, this is a tremendous sacrifice borne by all of our employees. Second, in order to reduce the probability of infection, we have redesigned traffic flow to our larger Dubuque facilities so that we can screen all patients entering our clinics. In fact, we have brought in temporary office space, pods we call them, into our parking lots so that we can safely screen patients before they enter our clinics. We direct all those with possible COVID infection to our acute care clinic on our East Campus, where we have created special exam space to further protect our providers from infection while we test patients. Third, we continue to offer medically necessary services that cannot be postponed. If you need care for injuries or other ailments, you should call your provider's office. In addition, we have expanded our 24-hour help nurse line for anyone who needs our help, and they can provide guidance for how to access care. Fourth, we have quickly implemented telehealth capabilities so that we can provide care to our patients without having them come into our clinics. Again, this protects the patient and eliminates the possibility of an asymptomatic or someone without any noticeable symptoms from passing the virus on to a care provider and staff. Currently, we have about 120 providers available via telehealth. Many of our patients with previously scheduled appointments have already been rescheduled with a telehealth visit. Patients who need care may contact their provider, and if telehealth is an option, it will be offered at that time. Fifth, we have a plan in place for our family practice and internal medicine physicians to help support our hospitalists if necessary in the case of a significant surge in hospital inpatient cases. Sixth, our incident command team is meeting 7 days a week in order to coordinate our operations and to react to the ever-changing situation. And we have individuals participating on MercyOne's incident command team, as well as ongoing communications with UnityPoint, Findlay, and Grand River Medical Group and Crescent Community Health Center. In other words, we are doing everything possible to protect our patients and our healthcare providers, and are planning for the worst so that we are as prepared as possible. What we need everyone in our communities to do is to take this situation seriously and do everything they can to reduce and prevent the spread of the COVID-19 virus. This means social distancing, hand washing, and staying at home if they can. If everyone will do this, we are confident we will be successful in this fight. Thank you.
Good afternoon. My name is Justin Hafner. I'm the Chief Executive Officer at Grand River Medical Group. Thank you, Mayor, Chad, John, and Kay, and fellow community leaders for pulling us together today. We understand this is a time of incredible stress and anxiety for everyone in the community. If you would have told us a few weeks ago that by the end of March, most restaurants were closed, schools shuttered, treadmills at gyms sitting idle, and ESPN apps without any scores, we wouldn't believe you. This situation has been fast evolving, and the speed and intensity at which it's impacted each of our lives has really been relentless. With that said, we want everyone in the community to know that we've pulled together to ensure that we can weather this storm together. I want to offer you the following reassuring advice. 1, our community hospitals have been preparing for this for years, and daily that preparation and their strength grows. 2, as a community, the availability of testing kits and supplies continues to improve. Thank you to all the gracious donors out there that have helped make that happen. 3, our facilities are safe and have comprehensive cleaning and sanitation protocols in place to ensure the safety of our patients. 4, for appointments or emergent issues that must happen and cannot be delayed, the day prior to appointments, our team of nurses call every patient and do a COVID-19 questionnaire. In addition, when they come into one of our clinics, they get that same screening and the temperatures taken to minimize the risk of mixing healthy patients with sick patients. Additionally, we've opened an upper respiratory clinic dedicated to focusing on our patients who are exhibiting COVID-19 symptoms, such as fever, cough, sore throat, or difficulty breathing. 5, we're doing everything we can to protect our patients' safety, and every one of our physicians is currently offering telehealth services. The goal of offering telehealth services is to minimize the foot traffic and offer patients the convenience and safety of seeing their physician from the comforts of their own home. 6, Grand River Medical Group, Medical Associates, Findlay, and Mercy Hospital are coordinating the sharing of staff, including nurses and physicians, to ensure that when the surge comes to Dubuque, together we're ready. Our top priority is to protect the community, our patients, and clinicians, the individuals representing the largest providers of care in the community are working together and marching in lockstep. Please rest assured, our biggest ask for the community is that you exercise social distancing, and together, this shall come to pass. Thank you.
Thank you, Justin. I'm Mary Rose Corrigan, Public Health Specialist with the City of Dubuque, and I'm representing the Dubuque County Public Health Incident Management Team that consists of Patrice Lambert, Director of the Dubuque County Health Department, Tom Berger, Emergency Management Director, Stacy Killian, VNA Director, and myself. This comprises the Dubuque County Public Health System, our County Health Department, our City Health Department, our County Emergency Management Agency, and the Dubuque Visiting Nurses, who we all contract with to provide nursing and other services. Public health in Dubuque County has prepared for public health emergencies since well before 2001. Similarly to our hospitals, we have learned and prepared for everything from biological, chemical, radiological, nuclear, and explosive situations, in addition to disease outbreaks and pandemics, such as the one we're experiencing now. I've taught healthcare providers how to vaccinate for smallpox, and our hospitals are equipped to deal with Ebola. These, like many other preparedness activities, have never had to be activated. But we have dealt with many outbreaks, including mumps, H1N1, and pertussis, just to name a few, along with new and emerging infections such as HIV, West Nile virus, resistant tuberculosis, and others. This all occurs in conjunction with our county and regional healthcare preparedness coalitions. Our Dubuque County Coalition consists of representatives from all the healthcare providers, long-term care facilities, the school systems, higher education, faith-based, childcare, EMS, law enforcement, and various community-based organizations. I will also add that even though the state and federal funding for these planning activities has continued to decline in the past 5 to 7 years, our local coalition continues to meet, train, and plan for public health emergencies. Specifically for COVID-19, we are engaging with the Iowa Department of Public Health and each other on a daily basis, and this informs Iowa's and the nation's response. IDPH provides specific guidance for us and for our community partners, along with sector-specific information guidance for schools, businesses, healthcare, childcare, and all other entities. And they've been very responsible to our individual county needs and requests. The Iowa Department of Public Health epidemiologists work directly with the VNA on contact tracing and notification of positive COVID-19 cases. More specifically, besides the healthcare provider collaboration and planning you are hearing today, our community response also includes long-term care, child care, food security, assistance for special populations, along with all the other responses occurring from the city and county government activities. Planning for the community fever, upper respiratory illness, or FURI, COVID testing community site continues. Representatives of all major healthcare providers are involved in either the planning or review of the proposed plan, including Dubuque city staff who are assisting with the site selection. After the plan is reviewed and vetted by the participating healthcare providers and the Public Health Incident Management Team, information will be distributed to the community. Please note that this implementation is based on the availability of COVID-19 tests and many other factors that continue to change every day. Dubuque has a history of collaboration and partnerships that has been demonstrated in past responses and is clear as we speak to all of you today. I'd be happy to facilitate questions of any of our speakers, and also note that Dr. Ron Iverson of Grand River Medical Group is also here to answer any specific medical questions you may have.
Can you help us have an understanding of the baseline capacity of our system amongst all the partners right now and then after, methods like doubling orders and delaying elective surgeries? What's our bed count or whatever that metric is?
Well, I know the metrics change regularly, but would you like to address that, Kay?
Yeah, so the surge plan that we've all talked about really takes into account the number of beds, equipment, monitors, PPE, all of that is really part of that plan. And I think we've done a really good job preparing for surge. And so, in some cases, up to doubling capacity, doubling current capacity. And our numbers, as I mentioned earlier, are down because we're trying to create space additionally for the surge if we need it. And I think beyond that, we're working together as a community. We're working with other facilities within our systems, as well as with local, state, national, federal, agencies to help us to make sure we have the equipment, the beds, and what we need when we need them. So I think we've done a good job preparing, and we don't know exactly, what the worst case scenario looks like in that situation. We're going to partner with agencies to help us to prepare for that. So.
And I would add to the question is like our total overall preparedness. If we reach our capacity, including the doubling up that Kay talked about, we will go through our emergency management agency to request state resources, and those come in a variety of forms to meet the community needs. Is there other questions? Yeah.
How is the Public Health Task Force keeping in with communication with hospitals to make sure they have everything that they need?
The Public Health Task Force stays in communication with the hospitals and the other providers. We have a weekly coalition call, and we are in regular communication with the individual clinics regarding their needs. all equipment, PPE, and needs that arise that are above the capacity of the institution or organization are funneled through the EMA, Tom Berger, who is part of our team. So we assess those. If we can meet those needs locally with local resources, we'll facilitate that from other agencies. If we can't, we'll ask for assistance from the state.
Upon what hospitals have right now, is it just a general supply of PPE that's being distributed equally amongst, or how is that working?
Would you repeat that, please?
Yeah, sorry. So there's obviously what hospitals have as their supplies now for PPE. Extras that are brought in, is that just being equally distributed, or how is that working?
The question was, how are supplies that are being brought in being distributed? An agency needing supplies reports what they currently have on hand and what their use is for about 4 to 7 days to our EMA, Tom Berger. And then so far, he's been able to accommodate all of those needs. So it's based on what you currently have, what you're going to need for the next 4 to 7 days. And then he, through his supplies he's receiving through the Strategic National Stockpile and through local donations, he's able to distribute those. Yes.
In regards to testing, currently, how many tests do we have in Dubuque County right now, and how are we preparing for when we reach the top of the slope?
The tests, I don't know that we have an exact count. Each facility is receiving tests from both the state hygienic lab and private labs, and those come in every day. When we plan for a community test site, we will make sure that we can accommodate the need and triage people accordingly to if they should be tested. Does anyone want to add to the testing question, Justin?
The answer I would give to reassure the public is our availability of testing, PPE, and other supplies increases daily. We're working with national labs along with private labs, and we are seeing that increase happen in real time. All right, thank you.
Do you have a question?
Yeah, is the team watching, the curves in similar communities that are farther along in this pandemic as far as numbers, and projecting what a total caseload might look like if we follow those similar surges, or?
The question, yeah, I get what you're saying. The question is, are we following other communities and the amount of cases they're getting and the curve of increases? I know other hospitals who have affiliate hospitals in other communities are doing that very same thing. The Iowa Department of Public Health really has the professional epidemiologists to be able to provide that for local public health, and they are working on models to plug those numbers in to help us prepare. And I believe they'll be coming out with those models shortly. So we do rely on the state epidemiologists to help us plan as a community, but as you can see from other Iowa communities, the number of positives are increasing at a more rapid rate every day. And so that's kind of how we plan for that. Does any other healthcare?
I was just going to say. Yeah, the only thing I would add is you're exactly right. I mean, I think one of the things about pandemic different than the other kinds of emergencies that we prepare for is the fact that it is changing minute by minute, daily. And we're able to, our plans are becoming more robust because we're learning from the experiences in other communities. So I think it's one of the unique things about this is our plans all look very different today than they did a week ago, than the week before that, because we have time and because we're learning from the experience in other communities. And of course, the big variable in all of that is the ability to contain it. So, if we can really control it, then we hope to avert the crisis that some of the other communities are seeing.
And just finally, with many of the predicting modeling out there for what's to come, there are a number of assumptions in each of those models that are often dependent on that community's demographics and other factors. So the state is developing a model that works for most communities in Iowa to help plan for that.
One of the other major concerns is the issue of transparency between government and public health and health officials in general with the general public. Since we last all gathered here together, there have been at least 20 more people who have tested positive for coronavirus. One person has unfortunately passed away, and of those 20 additions, one child tested positive. And the public is concerned about the transparency. How would you address their concerns?
The question is about transparency and about the cases that have occurred and even the unfortunate death in Dubuque County. And I can speak on a public health perspective, and my partners can join in with me. But for any communicable disease, it is considered private health information. And our standard way of notifying and preventing the spread of any communicable disease, particularly this one, is in a confidential matter. We rarely release any information much other than age group and broad location of a person regarding any disease. We have county-specific numbers on various diseases. Now, our public health nurses that are doing the contact tracing work those details and that information they have, but that is that's confidential health information. Does anybody? And I think all of our healthcare providers are bound by that confidentiality. And we know in a small community, it's harder when you release any other information about a person to respect their privacy. Yes, Bennett.
Maybe along those lines, I think it might be easy for the community to not really understand the metrics being used as far as, number of confirmed cases, number of, deaths, and then number of negative cases even. We have seen cases here locally rise, by percentage-wise, pretty big percentages, but it's still 21. I guess from the medical perspective, or the public health perspective, what do we look like in terms of anyone else? I mean, how afraid should we be, or the community be, when they see 3 or 4 more cases in a day? Does that compare with others? Is that just as we get more tests, we're going to see more numbers?
The question is about specifically how does Dubuque compare with our numbers with other communities, and how are we going to prepare for the potential exponential rise in cases. And I'll give the public health view, and maybe Dr. Iverson or one of our providers can speak to the rest. But if you look at the map of Iowa that's posted on the Iowa Department of Public Health website that shows the number of cases in each county and the color-coded, you'll notice for the most part, it's the higher populated areas have the more cases. And that's kind of emerging here the last week or so. So population and density of population definitely is a factor in the spread. That's kind of the big picture answer. Would anyone like to address anything further? I think a lot of it does depend on our messaging. The mayor and Mr. Baker have been giving since day one about the importance of really taking this seriously, and the fact that even though you're young and you may get a mild infection, you may potentially spread it to someone who's vulnerable. So within each community, we have to take it seriously and do our stay-in-place measures and only do essential trips. I have no magic wand to predict the numbers or how quickly they're going to go up, just that they're going to go up.
And then I guess kind of one of the last questions that I had was, of course, for preventative measures, I think we've been rolling out enough times, wash your hands, the 3 C's, social distancing. Is there anything else we can do to protect ourselves and our loved ones from getting sick?
The question is beyond hand washing and covering your cough and social distancing, what can you do to help prevent the spread. I think we have to think differently about how we shop, how we get food, how we check on our neighbors, how we assure that vulnerable populations are being cared for, how we communicate with each other. We have to do things differently, like Kay and Chad alluded to, that all the meetings are over the phone. I think we are all practicing that, not having friends over to your house for social engagements, even if it is just a couple people. You can't be assured, just by looking at someone, that they may not have the virus or be able to spread it to others. I'd be happy to have the mayor or anybody else chime in on this message. And I think another thing is just staying as healthy as you can. Getting good sleep, eating nutritious food, getting some regular exercise not only helps your mood with having to do things a lot differently, but it'll help your general overall health.
I think more than a week ago now, Dr. Canero had used a metric when he talked to us about, for every one confirmed case, there was this idea that that equated to so many unconfirmed cases in the community. I think at the time there were 4 confirmed in Dubuque County. He guessed that meant 200 people probably had the virus. How quickly are those metrics changing? Is that still the idea that the medical community has, or, I mean, is that consistent as we learn more about the disease? Is that changing? How many people does 21 people maybe mean? I mean, is there a guess?
Right. The question was regarding an earlier statement made by Dr. Bobby Canero about the potential number of cases in Dubuque being 200, with, at the time, being represented by the smaller amount of cases. And I am not comfortable making that leap or that statistical number at this time. There are a number of different models, like I say, and we are seeking, waiting guidance from the Iowa Department of Public Health to help us make those predictions. Anything else from anyone? Do you want to close? Well, I just offer it up to anybody else who has any final words, but I think this, I really appreciate our healthcare providers coming together along with our elected officials to support the public health and healthcare response in Dubuque. And we look forward to sharing information with you in the future.